Hello again. Next up, we're going to be doing active isolated stretching exercises for the lower leg and ankle. These are extremely useful for people that are on their feet a lot. If you happen to be a runner or a hiker or a basketball player and you're likely to twist your ankle and get an ankle injury, these are very, very helpful, both preventively and after the fact, to help you through in getting past the injury. So we'll start off, basically there's four basic motions of the ankle, and demonstrated here. There's dorsiflexion of the foot, where you bring your toes towards the shin. There's plantar flexion of the foot, where you bring the toes away from the shin. There's inversion of the ankle and eversion of the ankle. So those are the four basic movements that we're going to be doing: back, down, in, and out. So in doing those, we cover all of the muscles of the lower leg and the ankle that affect the foot. So this is a very important area to focus on. So first off, we're going to address exercise to get to the posterior part of the leg, and we'll start in this position. So you can sit on the edge of a chair, the edge of a bed like this, so that your knee is bent, and what you're going to be doing is you're going to be bringing your toes towards your shins, which you're going to engage the anterior muscles, and as you do that, engaging the anterior muscles, it'll cause a release of the posterior muscles. So to demonstrate that, we'll start here, and just like other exercises of this type, we start by taking a deep breath. So we take a deep breath in, and then as we exhale, we do the movement, bringing the toes towards the shins, assisting that motion with the hands, just so that you go as far as you're going to go. You hold it for 2 seconds, and then go down, and then you're going to repeat that 10 times. So exhale as you go back, hold it for 2 seconds, and down. And you repeat that 10 times. As you do this, you're engaging the front, releasing the back each time. So that addresses specifically the muscles, the deeper muscles of the lower leg and the back of the leg, soleus muscle in particular, that attach below the knee. So when you're in this position, it gets to that. Now if you do the same motion, but a different position, where your leg is extended like this, you do the same thing. You're going to bring your toes towards your shins, but in this case the leg is straight. And when you do this, you're going to get to the gastroc muscles, which are the more superficial muscles, and they attach above the knee. So when you do that motion in this position, you're engaging those muscles more. So you can target those by doing this position as well. So you do 10 of the motion where you bring your toes towards your shins when you're seated with the knee bent, and then you do the same motion, 10 of your toes coming to your shins with the leg straight. And this gets to the posterior muscles of the lower leg. Now to get to the anterior muscles, you're going to do just the opposite motion, and you'll start here again, and you'll start with your toes up, your foot up, and you'll point downward. Usually I'll assist just gently with my hand as they go straight down. So take a deep breath and exhale as you go down. You hold it for 2 seconds, and up, down. And what I tend to do is I'll do 3 repetitions going straight down, and then I'll do 3 a little bit off to the medial side, and then 3 off to the lateral side, just to get a slightly different line of pull. And again, what you're doing here is you're engaging posterior muscles to release the anterior muscles in front of the shin. So that's addressed the muscles in the back of the leg, muscles in the front of the leg. Now to get to the sides, the lateral side and the medial side, you cross your leg, and what you're going to do is you start like so, and you're going to bring the sole of your foot towards the ceiling. So This is an inversion motion. So you're starting, bring the foot so that the sole of the foot is pointing towards the ceiling, or at least that's the goal. You can assist with the thumbs are on the bottom of the feet, the fingertips are on the instep, and as you do this, you just add a gentle assist to that motion to make sure that you move as far as you're going to be able to move. Now this is generally easier to do for most people because there's more motion available at the ankle in this motion. But the next motion where you're going downward, there's less movement available, and for some people they won't get very much movement at all. But you just attempt to bring the sole of the foot towards the ground, and to whatever degree you're able to do that, you just do that, you attempt to do that motion. So in this case, you're starting here, and exhale as you bring your foot pointing towards the ground. Repeat, downward, and repeat. So you're going to do that just like the others, 10 repetitions in one direction and 10 repetitions in the other direction. So you've done toes towards the shins, toes down, foot turning inward, foot turning outward. These 4 motions address all of the muscles of the lower leg and the ankle. So there you have it. These may prove to be extremely valuable for you to do, so I encourage you to try doing that. So good luck.